Welcome back to Dementia Q&A, where we try to answer your questions about dementia in about 5 minutes with as little medical jargon as possible. I'm Dr. Marc, an internist and geriatrician here in Louisville, Kentucky. This is week 3 of a video series we're doing about care settings, places where someone with dementia might live, and care services, services that someone with dementia might qualify for or benefit from. In the first week of our series, we laid out the difference between unskilled and skilled care. And that's going to be relevant again today as we try to answer the question, what's the difference between a nursing facility and assisted living? I'd love to hear from you if you have experience with that. Drop me a comment or just send an email, drmarc@dementiaqa.com. First of all, both of these settings go by a whole bunch of different names. You might hear nursing facilities called nursing homes, skilled nursing facilities, or SNF for short. And if you're being discharged from a hospital, you might hear people talking about post-acute rehab, short-term rehab, skilled rehab. All of that generally refers to rehabilitation services provided in skilled nursing facilities. Assisted living might be called AL or ALF, ALF, assisted living facility. You might also hear assisted livings referred to as a board and care facility. And both the nursing facility and the assisted living can coexist inside a CCRC, a continuing care retirement community. So that's a tongue twister for sure. Let's tease apart the distinction between nursing facility and assisted living, and I'll try to put a one-page summary in the comments section so you can link to that later if you think that would be helpful. Nursing facilities generally provide a combination of unskilled and skilled care. About 80% of a typical nursing facility's residents live there. It's their home. They need help every day with their activities of daily living. That's the unskilled portion, provided mostly by aides and attendants. 20% of the residents of a typical nursing home these days will be the short-term residents who are coming for rehabilitative care before going home. To provide that skilled care, nursing facilities are mandated by Medicare to have on-site nurses, physical, occupational, and speech therapists, some degree of wound care specialty, dietitians, and so on. In all nursing facilities, the medications will be managed by the staff, either by a nurse or a medication technician. It's very rare to find someone in a nursing facility managing their own meds. All nursing facilities are also mandated to have access to physicians who can provide primary care on site. That's for the long-term residents and the short-term residents both. Let's contrast all of that to assisted living. Assisted living, just like any nursing facility, of course provides room and board and recreation services, but how much additional services they provide is really up to them, and then they can price those services accordingly because they're really private businesses and much less regulated than nursing facilities are. In general, there will be less occupational, physical, and skilled therapists on site. There may or may not be nurses on site depending on the time of day or how they choose to staff it. To some degree, medication management will be provided, but it varies. Some places will do more and some less, so you have to ask about that. In general, physician services on site in an assisted living are not mandatory, but lots of physicians are extending their practices into assisted living facilities, and that makes sense for both sides. But there are many people inside of an assisted living facility who travel out into the community for all of their medical needs. One of the things that assisted living provides that distinguishes it from being at home is that people are checked up upon frequently. And that's often really the difference for folks who feel much more comfortable knowing that their loved ones will have eyes on them frequently, if not multiple times a day. Let's talk about how nursing facilities and assisted living are generally paid for. For short-term rehabilitation, skilled care in a nursing facility, that's generally paid for by health insurance or by Medicare. If one is going to live in a nursing facility long-term, make it one's home, typically that starts off with families and people paying out of pocket. There might be long-term care insurance plans that they have that would pay for that for a certain period of time. But eventually, typically, people run out of funds and Medicaid becomes the ultimate payer until people pass away. On the assisted living side, it's almost exclusively paid for in cash or by a long-term care insurance plan if someone has that. Medicare, Medicaid, and private health insurance typically don't pay for assisted living. I hope that the distinction between a nursing facility and assisted living is useful to you as you plan accordingly for a loved one or even for yourself. Thanks a lot for watching today's video, for liking and subscribing and sharing as you see fit, and I'll see you all next week.